He was born in Petaling Jaya, University Malaya Medical Center, married, and he obtained his basic medical degree from University Technology Mara, and is currently pursuing his certificate to become an occupational health doctor with NIOSH. All right, so he has worked before. He started his housemanship in Hospital Tengku Ampuan Ahzan, Kuantan, and then continued at the emergency department in the same hospital before transferring to the emergency department in Hospital Kajang. And before he joined Hospital Pengajar UPM, he was a medical officer in the University Malaya Health Clinic. All right. So he's been involved in a number of activities with regard disease control. He was involved as the head of COVID-19 Health Unit Student Affairs Division in University Malaya. He was also a fellow in one of the residential colleges, and has also spoken in public webinars on the management and control of hand, foot, and mouth disease, and also methods on controlling and also managing COVID-19 infection in nurseries and kindergartens. All right. So without further ado, sila jangan betulkan skrin anda. Itu memang Dr. Mohd Zaid, bukan Kai Bahar. Jadi keep calm semua. Alright. Without further ado, I would like to invite Dr. Mohd Zaid to give his presentation. I would also like to request that everybody, if you have any questions, please hold it off until the end of the talk before we have a question and answer session, if you have any. Yeah. Alright. So persilakan Dr. Mohd Zaid.
All right. Wait, yeah. Stop sharing. Okay. Thank you very much, Dr. Suhainizam. Everyone can hear me, isn't it? So, Assalamualaikum and good afternoon, and to professors, doctors from the Community Health Department of UPM, my colleague from HPUPM, and welcome to team from SASMEC IIUM Kuantan Pahang. Before I proceed, initially I prepared this to deliver this presentation in English, but our staff request me to deliver in BM, so I decided to deliver in dual languages, which is English and also Bahasa. So my name is Muhammad Zaid bin Abu Bakar from Public Health Unit UPM Teaching Hospitals, or known as Unit Kesihatan Awam UKA Hospital Pengajar UPM. So as introductions, Public Health Unit HPUPM was established in 2020. So we provide services to hospital community, including staff, patients, visitors, and even contractors. We play important role in this hospital, especially during COVID-19 pandemic. So we collaborate with HPUPM management, other departments at HPUPM, UPM Occupational Safety and Health Management Office, and also PKD Sepang. This morning also we have a bengkel with PKD Sepang regarding the root cause analysis bagi indikator kadar sukses rawatan TB warga negara. So we have quite good relationship with them. So as the name stated, public health. So our responsible is in managing public health in hospital setting. To be more specific, we monitor the infectious disease surveillance, hospital environmental health, monitor the occupational health among staff, and also organize the health training and also educations. In line with the responsibility that we have, we monitor and enforce several acts, which are the preventions and Control of Infectious Disease Act 1988, Disruption of Disease-Bearing Insects Act 1979, Food Act 1983. Inside that also there is a Control of Tobacco Regulations, and also Occupational Safety and Health Act 1994. So let us go through the organizations. Organisasi, Carta Organisasi UKA. So we can see here, we are directly under the Deputy Director of Clinical Services. Our head of department, our lovely Dr. Suhail Nizam, is a public health medicine specialist and also lecturer from UPM. So assisted by us medical officer, we also have one nurse supervisor, not to forget clerk to do the administration's job. And under the umbrella of UKA, we have 4 subunits. We have first is epidemiology and disease control. Next is environmental health. We also have occupational safety and health subunit, and also training and health educations. So mari kita kenal lebih mendalam our staff. Our head of departments is Dr. Suhail Nizam bin Muhammad Saliduddin, medical officer me, Zaid, Muhammad Zaid bin Abu Bakar, and my friends, Muhammad Izami Ashraf bin Muhammad Amran. Also, for subunit, the head of subunit epidemiology and disease control is Dr. Siti Aisyah binti Mokhtar. Professor Madya Dr. Ahmad Zuhairi Arifin is the head of the subunit occupational safety and health, and head of subunit environmental health is Professor Madya Dr. Muhammad Rafi bin Baharudin. We have one matron Sanggari. Actually, ini adalah gambar lama, old picture. Dia baru dinaikkan pangkat as a matron on 1st of September. And we have 2 dedicated nurse is Shabarina, Rina, and also Jane. So next we also have health inspector kesihatan is Nur Aisyah binti Sabtu, and we have 2 PKA pembantu kesihatan awam Syamuddin bin Gonzalez and also Ami Mustaqim bin Hamzah. In future maybe kita akan tambah another health inspector, penolong pegawai kesihatan persekitaran. We also have our 1 science officer Nur Azwin, 1 assistant science officer Cik Suhaida, and also Nur Farahin as administrative assistants. So first of all, our roles our roles is prevention and control of infectious disease. We ensure the notification of infectious disease cases is carried out by the primary team within the stipulated period. We know that there is an infectious disease can be notified within 24 hours, need to be notified within the 24 hours or not later than 7 days. But we encourage the primary team to notify as soon as possible so that we can do the early preventions. These notifications is in accordance with the provision of subsection 10.2 of the Preventions and Control of Infectious Diseases Act 1988. So it's very simple. Semuanya melalui electronic, so e-notifications. So we have 4 accounts, 1 be suspended for some reasons, and currently we have 3 accounts, but only 1 account and digunakan oleh keseluruhan primary team when they need to notify the infectious diseases. So we also investigate any delay notifications. If there is any delay, lambat ataupun not notify at all, they can be compound under Prevention and Control of Infectious Disease Act 1988. So the general penalty, number 3, for any person guilty of an offence under this act for which no specific penalty is provided shall be liable on convictions: A, in respect of a first offence, to imprisonment for a term not exceeding 2 years or to fine or to both; B, in respect of a second or subsequent offence, to imprison not exceeding 5 years or to fine or to both. In respect of a continuing offence, and this one yang degil, to offer the fine not exceeding 200 ringgit for every day during which such offence continues. So for infectious disease of COVID-19 itself, we have dedicated WhatsApp group. This is very special, very unique, because we discuss everything regarding the COVID-19, and we can give plan management as soon as possible when we get the report ataupun laporan. So we work 24/7. We work 24 hours. They can report to us at any time. So we have a template. This template is very good because it quite detailed. Okay, pertaining to risk assessment. We need their details: nama, nombor IC, staff number, telephone number, positions or jawatan. But the important thing is the jabatan, because if there is outbreak, so we can prevent early. Other thing is tarikh akhir bertugas, so we can do the contact tracing accordingly. Alamat rumah, so that we can liaise with the respective PKD symptom-wise, because the high-risk symptomatic and high-risk asymptomatic, the management is quite slightly different. Test whether they do any tests, professional RTK or self-test saliva or nasals, any contact with positive cases and some history. Ada antara mereka yang suka buat karangan. It's okay, we will accept anything. Some of them tak tulis apa-apa lah, but it's okay, we can go through. And then the important thing is the status vaccine, because we know that the vaccination status can reflect to the severity of the disease. So it's quite important. And then we can categorize them into category A ataupun category B. So our aim for the infectious disease, specifically for the COVID-19, is the fast risk assessment investigations. So if there is any outbreak, we can control outbreak in our hospital and we can execute control measure as soon as possible. Because this WhatsApp group also very good, because when we get the reporting, contoh pukul 8 pagi, dalam 5 seconds we can give the plan and management very fast. So we can prevent very early. So we advise for this infection only if necessary. So this is the contoh lah. This is my account. You can see case notifikasi, COVID-19, dengue, HPUPM, tuberculosis, dysentery, and etc. So next roles or function is control of a vector-borne disease. So we ensure the notifications is the main one of vector-borne disease carried out by the primary team. We do the inspection of mosquito breeding sites every week. Okay, follow the epidemiology week. We know cycle of this Aedes is taking 7 days, from egg daripada telur sehingga menjadi nyamuk dewasa betina. That's why we do the mosquito breeding inspections every week. So we also control and do the prevention of lilati lipas, lalat, tikus, juga nyamuk. So pest control and fogging at HPUPM is done regularly by contractor. This is the picture. You can see penemuan tempat positif pembiakan nyamuk di rumah sampah. If we find this kind of place, we can destroy instantaneously. Kita boleh terus melakukan pembersihan. Kita boleh panggil muliawan dan pemusnahan pembiakan nyamuk ini boleh dijalankan secara cepat. Tapi if the breeding site is caused by the structure, you can see stagnant water here, we can put the A-bit. Next, kita juga jumpa yang peliknya di toilet bowl tandas pejabat asrama jururawat. I think this was quite some time, and then kita inform pihak yang berwajib untuk cleaning proses, untuk perbaikan tandas. And then this one is the penemuan tempat berpotensi pembiakan nyamuk di longkang harapan nursery Taska Cahaya Mata. The picture is sebelum, semasa, during, put the A-bit, and we ask the muliawan contractor to do the cleaning process. Also, this one is leaking from ceiling. Ini pun boleh terjadi tempat penemuan pembiakan, but for this case only the stagnant water itself lah. And then we destroy it. Next, our role is regular tobacco control and prevention programs regularly. So we do the routine monitoring and enforcement of compliance to smoking ban within the hospital territory. You can see beberapa orang telah ditangkap. This is actually a foreigner. Mereka tidak faham lah mengenai the enforcement of act ataupun apa yang kita lakukan di sini supaya tidak merokok di kawasan hospital. But we give memo, we give warning letter to the respective department, and until now, alhamdulillah, tak ada kes-kes yang membabitkan mereka. So, di bawah peraturan kawalan hasil tembakau pindaan 2017, denda 10,000 atau penjara tidak melebihi 2 tahun boleh dikenakan. So, antara tempat-tempat lain, it's quite interesting. Other than regular normal cigarette, kita juga jumpa rokok daun, vape. Vape pula owner tak nak mengaku, kata bukan dia punya, tak tahu siapa punya, padahal dekat atas meja tersebut lah. And then tempat yang selalu menjadi hotspot, tempat merokok, biohazard, dijadikan tempat rehat dan tempat merokok, and also parking lot. So what we did is kita pasang papan tidak boleh merokok, tidak dibenarkan merokok, dan kita we recommend to put CCTV, and also we give memo to the respective area lah. Kita find this way, kita nampak macam under very care, so we give memo accordingly. So this one is the pelan tapak dan plotting lokasi penemuan pelanggaran arahan larangan merokok di kawasan HPUPM. So kita plot dan kita tahu. Next is nursery inspections, quality and risk. Can see several times problem with this nursery. From January, we have acute gastroenteritis, same disease, April, but this one is infective, AGE. March, HFMD again in May, and also March, also we have COVID-19 cases among teacher. Ini kerana mereka tidak report, they do not report to us. So it's very important, any cases, kalau it's not our staff, just contractor or vendor whatsoever, you need to report to us so we can take necessary control measures. So until now, in May, kita sama-sama dengan PKD SPA do the inspections at the nursery, then we close the nursery for quite some time. Until now, there's no cases. So next is food safety and also quality. We carry out inspection of food premises, including cafe, including grocery store, and we advise unhealthy food tidak dijual di kedai-kedai tersebut. So this premises also need to register under FOSIM domestic. It's the Food Safety Information System of Malaysia. Then we make sure the food handlers already received typhoid vaccinations, did the training and practice hygiene, also wear appropriate PPE. So the food that served to us, inshallah, is healthy, is clean, and is good lah. So this one adalah pemeriksaan kebersihan cafeteria berdasarkan risiko. This one is our cafeteria. So we move to occupational medicine clinic under the umbrella of occupational health. We opened from Monday to Friday, from 8 a.m. to 5 p.m. We close Saturday, Sunday, public holidays too. This was the common working office hour, working hour for clinic. But currently we give TCA only by appointment. Our location at the level 1 HPUPM in front of ophthalmology specialist clinic. So I just like to share regarding the statistic from the Department of Statistics Malaysia, National Occupational Accident and Disease Statistics. This one is quite important sebab kita lebih kepada penyakit biasa. Kadang-kadang penyakit pekerjaan kita tidak memberi lebih perhatian. So the statistics showed 15.6 million affected. Yeah, it's not only affect male, it's also female, but the numbers is differ. All age group will be affected, and then it's also actually depend on the hazard itself. Can see there is a radiation. We have radiology staff, and you can see services menyumbangkan sebanyak 4,299 under the statistic. The injury can be from head to toe. Okay, and then we live in Selangor. Can see the state Selangor 4,195. So the hazard type, this one is the common five types of hazard: biological hazard, bloodborne, HIV, hepatitis C, hepatitis B. Ini biasanya staff yang terkena needle stick injury can expose to this one, and also human bite, for example, airborne pathogens TB yang kerja di high risk area, for example, our SP clinic, physical hazard radiation, radiological staff, chemicals yang kerja di pathologies, ergonomic. I think everyone, we cannot afford to get ergonomic chairs whatsoever, so can present it with the kind of musculoskeletal diseases, and psychological, I think, affect everyone. So first of all, we provide consultations and treatment for new and follow-up cases related to occupational diseases and also injuries. You can see here the statistics, the numbers actually, from 2020 to 2022 until 22nd of September. Cases in 2020 is for needle stick injury, the number is 3, skin allergy 1. This one related to latex injury, so we changed to nitrile. And then we have upper respiratory tract infections. Maybe they being exposed to new place, aircon, whatsoever, but related, work related. And then 2021, in needle stick injuries, 9 cases, human bite, 1, mercury spillage. So this mercury spillage, kita terpaksa panggil bomber, and then we close the area for some time. And then fitness or impairment assessment is light duty. Actually, we usually get the referral from the orthopedic clinic, and then we will certify whether this patient is eligible for light duty or not. And others, pada tahun 2021 ini ada pesakit, ada staff ditampar oleh pesakit. And 2022, needle stick injury, now currently we have 5 cases, human bite. Actually, this human bite is from pediatrics and also psychiatry patients. And also we have fitness or impairment assessment like duty, and also upper respiratory tract infection. This one is related to fungal, because the fungal problem is dekat kita punya rehab, so affect our staff. They presented with the upper respiratory tract symptom. After the examination, CS is work related. So next is medical examination for radiology staff. For radiology staff, we do the medical checkup. 2021, there is a 6. The number is 6. 2022 until now is 44. And then we do for pre-employment, pre-placement, periodic every 3 years, and pre-retirement medical examinations. Starting from 1st of September, we do centralized MEN2 test for TB screening. All primary team need to go through us first to do the MEN2 test. You can see here, after 22 days, we have 20. We have number of 20s. The referral is from pediatrics, 6 patients, medical 1, family medicine 2, ENT 2, orthopedic 1, executive ward is previously is a ward warga, and then clinic mata 1, urology 1, and others is 5. Others ni biasanya they should go to nearest health clinic, but because they are our staff, so they ask us, then we give the appointment. So we do the MEN2 test here. Next is hepatitis B screening program for new staff. So from 2021 to 2022, this is the number. Ini adalah numbernya. So hepatitis B screening for our staff, we took hepatitis antibody only, around 825. For hepatitis B injections, after we see the titer, we identify siapa yang perlu, siapa yang tidak. Total number is 208. For students, we give the hepatitis B injections, number is 311 students. So 2022, we do the hepatitis program, hepatitis B screenings, 393. Hepatitis B injections, we will give 133. 109 akan diberi pada 27 September next week, and for student, we will give the hepatitis B injections around 27. Student will be involved. So next is others. Others is related to public health or occupational health. So we also give typhoid vaccinations in 2028, 2021, 4, 2022, 20 vaccination we gave. And then actually they are from dietitian and also NICU. NICU, the one that handles susu budak tersebut lah. So influenza vaccinations only we give in 2020. 70 staff we give the influenza vaccinations. So next is our sub-unit training and health educations. This program activities is from 2021 until 2022, January to September. So last year, we know that we are in pandemic. Most of our kebanyakan program kita adalah melalui webinar, melalui online. So our first webinar series is Stigma and Diskriminasi, Cabaran Pengesanan Awal dan Penyembuhan. In conjunction with World Leprosy Day, kita buat pada January 20 and 21. So our moderator is our doctorate in PH students, and we invite outside speaker. Next is webinar, Isu and Cabaran Menangani Kanser di Norma Baharu, in conjunction with World Cancer Day. Also, the moderator is our students, Dr. Khairul Hafiz, and speaker from outside. Then we also collaborate with psychologists, with psychiatrists. We invite them to give talk. So the webinar series 3 is aplikasi psikologi dan kesihatan mental dalam mendepani pandemik COVID-19 in conjunction with World Health Day. We also have several blood donation campaign. Kita ada beberapa, kita buat 3 ke 4 bulan. And then we have tuberculosis management course. They will talk regarding the situations, TB situasi di Selangor specifically, and how to notify the management and etc. So next, we also have webinar OSH training for healthcare and accident investigations, preventions and reporting. This talk given by our lecturers is Professor Madya Dr. Anita and also Professor Madya Dr. Muhammad Rafi. Kita juga diaudit oleh KEPAS, Occupational Health and Environmental Audit, and also OSH, UPM OSH office regarding the infectious disease lah, for this OSH UPM office COVID-19. And then webinar, we have this earlier in January, New Year, New Health, Local Hero, Lifesavers. So this one we collaborate with the UPM students. They invite us, we give the talk regarding the blood donations. Then we have diabetic educator course in January also. This is the basic program for healthcare worker, blood donation campaigns. This year ada 2 kali. And then HPUPM Occupational Safety and Health Week. We invite speaker from our university UPM, and then we invite pasukan bomber to do the demonstration and also talk regarding the fire itself in May. So in May also, we've been invited by the UKM students. We have many collaboration actually. And then I give talk regarding the HFM di Menganas, apa ibu bapa perlu buat. Then we have tabletop exercise. This tabletop exercise is organized by our doctorate in PH students in relation with the special topic in occupational medicine. In June, we also have refresher course diabetic educator, and the latest one we have program pendidikan kesihatan air minum bersama komuniti orang asli Ulu Cuai Rembau. This is collaboration with Dr. Shahrudin, and what we do, kita bagi health screenings, and this is very quite interesting health screening that we did with orang asli. So challenges in the management of COVID positive staff and patient during the pandemic and endemic phase. We can see the statistic. I would like to emphasize regarding this statistic only in this year, 2022. We can see we have 3 phases. Kita ada phase first pandemics in this earlier, and then we have transition to endemic in April. Then currently it's endemic. We can see here in January keep increasing, naik 512 in February, naik kepada 667 in March. But surprisingly, during the transition period in April, it's decreasing to 101 and become, I think, below 200 until now. So the lowest one in May is 32 number of cases. And then kita investigate more, where is the source of infection, daripada mana mereka ini dapat jangkitan. So most of them is from community, and some of them is local or workplace transmission infections. And then at some point, we don't have any workplace source of infection at all in April and also May. We also see the vaccination status related to their severity. Most of them is not very severe, around 2A to 2B, Cat 2A to 2B, and some of them is even Cat 1. And the total cases, positive and close contacts, we divided them into category A, category B, and also category C. Category A is a positive cases. In the early years, in this early 2022, we do the risk assessment until group C, category C. And then we can see kebanyakan daripada patient dalam kategori B, mereka akan menjadi positif. That's why this is very important. That's why everyone need to report to us. And then group C also, several of them become category B. So the challenges that we face, especially in the pandemic phase, can see when the number of patients increase, so the number of beds also increase. We need to open more ward, yeah, And then when there's more ward, we need to mobilize staff. Kita terpaksa mobilize staff. When we mobilize staff, akan menjadi issue to the manpower. And then some of the staff also become positive. Ada yang bekerja di ward COVID menjadi positif. So we are understaffing, but our service boleh jalan seperti biasa. It's no problem. And at some point, we also advise for the temporary closure of operation theatre. This one is just temporarily screened. Then when we get the results, we can open back the operation theatre. And then ada satu medical ward also we close. This also it can affect the psychological for the burn out from stress. We also receive the call at 2 to 3 a.m. But for us, it's okay. But this is the challenges that we face, especially during the pandemic phase. So this is just the table yang kita nak tunjuk bahawa semasa pandemic, how we cater bilangan pesakit. You can see kebanyakan daripada ward ini adalah penuh, full capacity. And then we can see patient from my age, category 3, 4 from my age. And then when we have the kind of arrangement, kita akan tahu yang mana kosong dan kita boleh tambah. Yang mana kurang, yang mana lebih, kita hold ataupun kita buka tempat yang baru. So during the endemic phase, I think when the SOP become loose, people become more relaxed. Kita akan jadi lebih tak apalah, perkataan tak apalah. So we don't want to report under-reporting cases, or maybe some of us just report through the MySejahtera and get EHSO. I think this is the important thing. Our staff need to report to us because we also have the authority to sign the hard copy of HSO. Because we still use the protocol, we use differently protocol for healthcare worker, management, and also public. So untuk healthcare worker, we can ask them to stay at home if for the home surveillance order if they presented with high risk symptomatics. So kalau dia datang kerja pagi pun pukul 8, pukul 9 kita dah boleh suruh balik. This is very important. And then we can do the contact tracings in a very early stage, as I mentioned earlier regarding our group discuss. And then second challenges, delay in seeking treatment. I get reporting dah simptom dah 4-5 hari, tapi hari kelima, hari keempat baru pergi buat test. So this is not a good practice. Actually kita jangan rasa kita telah selamat. We still dealing with COVID. If presented with the symptom, just do the rapid test. So I think that's all. And so we Public Health Unit HPUPM will continue providing the best services. If anything, nak share dengan kita, nak give opinion, nak collaborate whatsoever, you can telephone us. This is our number 0397699050 ataupun our clinic 79695778 ataupun can write to us and send the email through the uka_hpupm@upm.edu.my. So thank you very much. Saya serahkan semula kepada Dr. Suhaini.
Okay, thank you Zaid for the comprehensive presentation. Okay, so basically what's happening is I think what's important in setting up a unit kesihatan awam at the hospital would be one to really be sure of what your job scope would be. Otherwise, they have a tendency of giving whatever task that other departments may not want to carry out to UKA to handle. Also important to be very certain in the planning of your workforce. You need the different categories of staff to be part of the unit or department to carry out the different functions of unit kesihatan awam. Also very important, I think, is in terms of training. And for this one, good relationship and collaboration with the local pejabat kesihatan daerah. For us, our main, the PKD that is responsible in the area we are in is PKD Sepang. And I think because we've built a relationship and network with PKD Sepang, so in case we require any assistance or any clarification from them, they are willing to help. Okay, all right. So any questions from members of the floor, either to Dr. Zaid or to myself? Boleh, silakanlah utarakan soalan anda. Soalan, yeah, go ahead.
I think Dr. Suhaizam boleh baca ni lah, in the chat box first.
All right, chat box. Thank you, presenter. Good presentation. Okay, congrats, Zaid. May I ask a question, you may? How is the uptake of TB screening of workers in HPUPM? If low, what are the challenges and what do you do to rectify it? Dr. Zaid nak try jawab ke?
Okay, actually the TB screening, we do a screening for all of our new staff. Semua new staff datang masuk, kita terus buat TB, for TB screening, actually for the high risk area, we do the TB screening. And then actually the TB screenings we centralize at our clinic. There is no, I think, challenges that we face. Just the problem is when there's positive cases, we need to refer to respective department, i.e. the recipe team. But some of them can refer to health clinics outside. So actually it's not very challenging, but we can still cater with that.
Actually for benda-benda macam ni, we still follow whatever guideline that is issued by KKM. Sebab walaupun as a teaching hospital, we are under a different ministry, but for medicine and health services, we still abide by whatever guideline that is issued by KKM. Alright, so dalam guideline for TB among healthcare workers ni, the targeted groups are the ones who are high risk at being exposed to tuberculosis lah. Jadi kita tak adalah buat screening untuk ke semua 600 lebih staff kita. Mana-mana yang kerja dekat klinik, chest clinic, kat FMC mungkin. Those that are exposed possibly to TB. Jadi kita identify dan kita akan panggil dia lah untuk melalui TB screening. Kita buat MAN2 dulu. Depending on the result of the MAN2 test, if they require further investigation, then they will be directed to do the further investigation, chest X-ray, sputum kalau perlu, accordingly lah. Periodic screening, kita baru start tahun ni je benda tu. Tapi kita akan ikut recommendation as per guideline of KKM lah.
Okay, Assalamualaikum.
Waalaikumsalam.
Okay, thank you Dr. Nizam, Dr. Zaid atas jemputan. Saya ada tiga soalan, three questions. The first one is about the establishment. Okay, the first one is masa mula-mula penubuhan UKA, any model that you followed? Model means any template that you followed to establish UKA in hospital UPM, and regarding the documents for the establishment, is it developed from scratch ataupun mainly adoption daripada PKD?
Oh, okay. Template kita tak ada, but what we did masa tu Dr. Aidalina was helming the unit kesihatan awam. So I believe she inquired from several other hospitals that already have a UKA in existence. Jadi kita jadikan itu sebagai panduan lah in coming out with the pejawatan and what are the units and the responsibilities. Documents untuk establishment of a UKA. I think each organisation would have their own procedure, kan, what are the documents required. So I would not know macam mana UIA punya system. So you need to inquire that, what are the required documentation, dia nak proposal ke, dia nak apa ke, because you need to ask for pejawatan, and when you have pejawatan, there is monetary implications in terms of emolument dan sebagainya. And also if you are starting a clinical service macam occupational medicine clinic, then the equipment, clinic space tu kena ada juga. Yeah. So those are the things yang biasa kita buat lah for the establishment of a new unit.
Oh, okay. Saya extend sikit soalan tadi. Maksudnya kalau dokumen, contohnya Nedoport atau dan kalau CDC in terms of borang notifikasi. So is it using form yang sama dengan KKM ataupun just modify sikit and make it as a UPM?
Notification kita pakai form yang sedia ada daripada KKM dan sebagainya. In fact, sebab kita kerjasama dengan PKD, sebab tu kita boleh dapat password dengan username untuk e-notification. That one you need to work closely with your local PKD lah. Kalau tak dapat tu for you to do the e-notification. But the rest of it, all the borangs, all the whatnots, the same ones in existence.
Oh, okay, alright. Dari segi yang e-notice dan sebagainya, yang tu clear. Maksudnya kita ada direct link dengan PKD, which is good. In terms of the hospital punya health information system, unit UK ada tak activity ataupun some analysis that you carry out menggunakan health information system of the hospital lah, in terms of clinical dan sebagainya?
Contohnya apa, Dr. Tri?
Contohnya macam patient, contohnya macam in terms of bed occupancy, and then in terms of the management lah, dalam clinical management, ada tak Uni UKA analyze that data to improve the patients punya and also the services lah in-house, selain daripada notification yang e-notice?
I think for the management, kita serahkan pada primary team, the team that is actually treating the patient. Kita tak ada masalah, kita yakin our clinical colleagues, dia punya clinical acumen tip top. So management tu kita bagi kat dia. We assist in terms of bila dia ada masalah, dia kata patient ni nak masuk tapi dia punya PCR positif ke apa benda ke kan. Or in cases macam patient tu contohnya dia had prior infection with COVID-19, so you would expect dia punya positive result tu to continue for the next 3 up to 6 months kan. So they are uncertain of what to do. Jadi kita give our input lah. At the same time dekat hospital kita ada medical punya COVID team. Jadi in terms of clinical management, what they are uncertain, biasanya clinical COVID team ni akan datang review the patient, and they will come up with their own recommendations lah in terms of clinical management.
Okay, terima kasih Dr. Nizam. Sorry banyak sikit soalan. Dua lagi daripada saya. Okay. In terms of the staffing, contohnya tadi Dr. Zaid ada sebutkan pasal management dan juga staffing. Dari segi contohnya macam dari segi link ataupun services dan juga manpower daripada JKK, Jabatan Kesihatan Komuniti, macam mana as lecturers you macam mana divide the time? Is it like for JKK punya members, you need to be there 24/7 ataupun macam mana? Ataupun there are certain time frames for you to be at office HPUPM dan juga department?
Tak ada requirement yang mengatakan lecturers who are in JKK, in the faculty who are also in UKA at the hospital, the time that they need to allocate lah. Sebab our task as lecturers still continue in terms that we do the teaching and whatnot and all the other KPIs. But at the same time, we also provide service at the hospital.
Okay, maksudnya pandai-pandailah kan cari masa. Okay.
Semua dah besar, boleh manage time.
Okay. Okay, ni soalan Dr. Zaid lah. Saya nak dengar juga. Ni Dr. Zaid bersuara. Kai Bahar kan? Okay, dari segi pemusnahan tempat perbiakan PTP kan untuk EDIS, actually apakah border, why is actually the border demarcation untuk services PTP fogging yang diuruskan oleh Uni UKA? Maksud saya, contohnya kita macam di UIA kita ada kampus, sebelah kampus kita ada SASMAC, maksudnya hospital. So actually dia ada certain border lah yang divide campus dan juga UKA. So in terms of activity tu, macam mana you all divide?
Actually in hospital setting, kita buat PTP tu dalam hospital saja. Kita tak pergi ke UPM campus lah. And second thing is regarding the fogging, actually it's under engineering. Pest control, fogging under engineering lah. Under third party lah, contractors.
Okay, kalau di kampus, siapa yang uruskan fogging dan PTP tu? Adakah University Management ataupun PKD? PKD lah.
I think PKD dia tak masuk under university. PKD ni biasa dekat luar sajalah. Under University Management lah. Maybe engineering because in campus I'm not quite sure lah. But in hospital I really sure.
Kalau dekat faculty, fogging kita buat kalau ada outbreak je, bukanlah macam regular punya benda kan. So kalau under outbreak, then PKD akan masuk lah. Ya. Tapi sekiranya kalau katalah nak buat, ada yang nak buat periodic activities ke, then that will be under the faculty. They will need to appoint contractors lah ataupun vendors untuk buat tu.
Okay, alright. I think that's all from me. Thank you very much.
Yep.
Okay, ada apa-apa soalan yang lain untuk ditanya daripada peserta-peserta?
Okay, Assalamualaikum. Boleh dengar suara saya?
Kuat sikit boleh?
Dr. Fadi, cakap kuat sikit boleh?
Merdu lah.
Sekarang boleh dengar?
Okay.
Alright.
So currently we don't have saya Dr. Fadi daripada SASMAC. So basically we don't have a proper UKA setup in our hospital yet. So that's why we are very grateful that UPM invited us to join this CME. So saya tertariklah tadi bila Dr. Zaid present regarding the staffing and also the job scope of the staff. So currently we don't have IK, penjawatan IK kita tak ada. So bila kita nampak ada IK mungkin perlu sebab sekarang ni kita tak ada macam pengawasan kalau cafe ataupun dekat ni lah kira macam tempat pembiakan ataupun kawasan orang datang merokok ke apa, kita tak ada. Yang tu memang ada security je yang kita tengok kadang kalau ada orang smoking ke apa. Cuma I was wondering if let's say IK datang and they notice those place, for example ada jentik-jentik kan, and then is it like macam how they issue the compound? Is it like they notify to PKD so that macam katakan kuasa untuk menutup the area? Let's say there's an outbreak dekat kita punya nursery, who give the kuasa untuk menutup kawasan tu? Is it like the IK from UPM that really can tampal notis kat situ, ataupun PKD kena datang untuk beri arahan untuk tutup lah? That's my question lah. And also the compound compound lah, is it like macam kena PKD ataupun kita boleh compound directly? That's one of the question.
Kuasa untuk menutup, kuasa untuk compound dan sebagainya, again you need to work with the PKD and also KKM. Sebab walaupun kita bukan staff KKM, tapi if you have your IK contohnya, ataupun saya sendiri sebagai pakar perubatan kesihatan awam, kita boleh memohon kepada KKM untuk diturunkan kuasa untuk enforce all the akta dan sebagainya. But I believe we don't have kuasa macam pegawai KKM yang full lah. Ya. Kita boleh in terms of food, tobacco. So maknanya bila kita memohon pada KKM pada bahagian penguatkuasaan dia, ada borang untuk diisi dan sebagainya, so kita pun akan dapat kad kuasa tu lah. Cuma dia adalah limited in terms of akta apa yang kita boleh laksanakan, and also the apalah. Tapi our pegawai kesihatan persekitaran memang nak buat application, jadi in terms of compounding untuk kesalahan rokok boleh dikeluarkan. Jadi kita tak adalah kena tunggu PKD datang every time kalau kita ada case. Kita sendiri dah ada diturunkan kuasa untuk enforce the articles within the act. Itu boleh dibuat.
Alright, thank you Dr. Nizam for the thank you Dr. Nizam and team for the explanation.
Alright, you're welcome. Ada soalan-soalan lain lagi berkenaan dengan UKA di hospital?
Assalamualaikum Dr. Nizam. My name is Dr. Dina, coordinator of the Clinical Management Unit. So as Dr. Edry mentioned just now, we are still yet to establish a UKA. Currently, we have a Clinical Management Unit, which I think is doing parts of, clinical management. Macam orang kata macam OSH punya things kita buat, kita bekerjasama dengan engineering, dengan BDU untuk check cafe, tapi nak kata specifically we're doing exactly what UKA needs to do tu belum lagi lah. I just like to inquire, for UPM, I understand that HPUPM started in 2019. Was the UKA established macam before the hospital, memang community health department dah masuk dan bagi idea macam mana penubuhan UKA di hospital, ataupun adakah macam hospital dah start, you dah ada MOs inside the unit, baru you form a proper department?
We came in quite a bit later daripada hospital dah start running sebenarnya. So we came in a bit later. So masa tu memang kena start daripada zero lah. You need to determine who are the staff that you require, what are your activities, and what are the other resources that you would need to run public health activities in the hospital setting.
Have service MO ataupun it was just purely the community health department that had come in and led the way?
Masa tu startingnya kami daripada community health department lah in the faculty, but then we put in the application for staff, and then we got the nursing staff dulu, sebab nursing staff memang ada kat hospital kan. Sebab our MOs came in a bit later lah, lepas kita dapat approval for the pejawatan and whatnot, barulah kita conducted our interviews, sebab our MOs are hospital staff, Zaid dengan Izami, and the rest of the staff in UKA, other than lecturers, kaki tangan HPUPM. Sedangkan kami lecturers, we are staff of the faculty lah.
Right, understood. And then with regards to template, can I know which universities ataupun hospitals that you liaise with? For example, for us, we have made a visit to UKA HTA because that is the nearest KKM hospital lah. Tapi dari segi untuk HPUPM, adakah berbincang dengan HPU lain ataupun dengan Serdang Hospital?
Kita sebab Serdang yang paling dekat kan, kita punya neighbour, next door neighbour je. So and then some of our staff pun sebenarnya dia pernah bekerja dekat hospital Serdang, jadi dia tahulah the setup dekat situ. Jadi kita jadikan tu sebagai panduan juga lah.
With regards to macam HCPM ataupun PPUM, ada
Yeah, we went to visit PPUM sebab dia orang pun ada quite well established activity yang samalah. Jadi kita pergi, we got the information, and then dari situ kita adjust lah kita punya establishment.
Thank you very much, Nizam.
Okay,
May I chip in?
Yeah, sure. Ada Lina, kita punya mantan ketua UKA who was involved from the beginning untuk mewujudkan unit ni. Sila Dr. Aida.
Okay, betul, saya setuju dengan Dr. Suhainizam, and I understand your concern about penubuhan UKA. For your information, UKA ni adalah satu unit yang agak baru di mana-mana hospital pun. So semasa penubuhan hospital UPM ni pun kami pun tak berapa sure about the unit per se, sebab masa tu banyak hospital KKM pun belum ada lagi. So along the way, macam Dr. Suhainizam cakap tu, kita bermulalah mewujudkannya unit UKA ni, dan macam Dr. Suhainizam cakap tadi, memang kita mula dengan lecturer JKK, Jabatan Kesihatan Komuniti, kemudian dengan beberapa orang staff nurse. Based on your question, sama ada template ke tidak, well, at the very beginning, there were not many places that we can refer to lah, sebab daripada aspek hospital university pun saya rasa ada universiti, saya rasa macam USM ada unit kesihatan, tapi dia bukan panggil UKA, dia macam CPCP, belum masuk full lagi UKA-nya tu. Kecuali UM seperti yang Dr. Suhainizam kata, kami memang pergi menapak, pergi sana tengok macam mana dia orang buat. Mereka pun masa tu baru bertatih-tatih lagi. So but then we kind of get the idea lah. Masa tu kami pun dah ada structure dia, dan kita tengok kita lebih kurang sama, cuma mereka lagi detail, so we try to simulate that lah. UKM belum ada UKA, HUKM tak ada UKA lagi setakat ini, mereka pun masih lagi ni. Tapi all these hospitals, having said that, although they don't have the UKA unit per se, they do have some sort of OSH kan, ataupun engineering services, ataupun macam infection control kind of thing, tapi cuma mereka tak combine together jadi UKA lah. So I think HPUPM is among one of the first few hospitals pengajar yang ada UKA. So of course along the way it grew dengan leadership of Dr. Suhainizam pun dia semakin berkembang. Dulu kita berapa orang je, Dr. Suhainizam boleh kira dengan jari je. Sekarang tim kita dah separuh office tu kita dah conquer, ruang lantainya dah bertambah-tambah. So dia kena ni lah, nak bermula you begin dengan unit-unit yang penting dahulu seperti epidemiologi dan statistics tu, kena tengok kawalan penyakit, kemudian you build up lah. Occupational medicine pun penting, dan promotion. Yang lain-lain tu kita build up, dan you kena berhati-hatilah scope service you tu, jangan terpijak kaki orang lain, don't step on other people's toes. Macam kesihatan keluarga dan sebagainya kena bincang elok-elok, tengok apa scope you semualah.
Yeah. Okay, so that means for example, you have your own family health clinic which caters to staff. And you have your own.
We don't have that yet.
Okay.
We don't have that yet. Dia masih lagi dalam proses pemurnian dan penelitian lah, ya kan Dr. Suhainizam? I think for now kita cuma ada occupational dulu. Nanti later kita akan selaraskan, sebab dia kena hati-hatilah, tengok mungkin kita termasuk dalam term of reference orang lain punya klinik juga. So ini adalah masalah yang sama berlaku di UM pun, mereka pun sama juga. Saya baru-baru ini pergi ke HUSM pun, mereka pun macam tu juga. Dia macam kena, you have to be very careful where you stand and what is your scope of services lah. Kena bincang dengan seluruh hospital, tak boleh buat sendiri-sendirilah ya. Macam tu. Okay, that's all from me.
Thank you. Just to clarify tadi saya kata boleh compound tu kan, itu dah terlebih gila kuasa. Pegawai yang mendapat turun kuasa daripada KKM, we don't have the authority to issue compound. Tapi other parts of the enforcement tu kita boleh buat. Kalau nak compound tu memang kena by PKD lah pada masa macam ni.
Saya rasa compound tak boleh kan, cuma kita boleh macam sign home surveillance order boleh kan yang hari tu yang COVID itu yang tu melampau lah kan, kita gila kuasa mengompang. belum lagi hopefully one day.
Actually, because we under KPT and KKM, they have their own lawyer and then they can issue IP number. So kita tak boleh nampak benda tu. Kalau nak buat, kita kena ada our legal sendirilah. Itu kita kena bincang dengan pihak pengurusan UPM. And then if we want to do compound, we kena operasi bersepadu lah. Dan duit tu sebenarnya tak akan pergi ke HPUPM pun, dia akan pergi ke KKM.
Okay, alright. That was another thing yang I was wondering lah. Sebab kalau compound duit pergi ke mana? So,
Dia tak punya kita.
so kalau kiranya waktu compound tu is dengan kuasa lah, maksudnya bersepadu sekali.
Yes. Kalau kita ada kita punya lawyer, kita boleh issue IP, bincang dengan universiti, so itu boleh.
Okay, alright. Thank you.
Right, any other questions daripada mana-mana peserta yang nak tanya, nak find out ke? Team daripada UIA dan daripada SASMAT, we welcome if you want to berjumpa, nak datang sini ke, we can take you around, because another component I think that we also need to consider is UPM sendiri ada pejabat OSH, yeah, who oversees all the occupational safety and health aspects of the whole of UPM. And kita beruntung kerana pengarah pejabat OSH UPM adalah Prof. Rafi yang juga di dalam tim kita. So kita boleh bekerjasama dengan dia lah dalam hal ni. Yeah. But they are the main authority lah yang menjaga occupational safety and health untuk seluruh UPM, and UKA would be carrying out our task at the hospital level. Yeah.
Saya nak berkongsi sikit lah. Kalau di UIA Kuantan, kita tak panggil pejabat OSH, tapi kita panggil Occupational Safety and Built Environment, OSHBE. Tetapi level dia adalah Deputy Director. Ketuanya adalah Science Officer saja, Senior Science Officer lah. So sedikit berbeza. Yeah. Tapi again Dr. Nizam, insyaAllah I think kalau ada kesempatan, we will be very glad to have a visit to your site.
Dipersilakan. No problem. Any other questions from any other members attending this CME session? Kalau ada, silalah kemukakan, either to myself or to Dr. Zaid.
Boleh ke saya nak tanya satu lagi?
Boleh tanya.
Okay. I'm not sure, tapi di mana di universiti di Malaysia kita ada tak satu public health punya department lah, tapi public health punya macam mini PKD yang akan selaraskan aktiviti-aktiviti kesihatan awam di kampus. Setahu saya macam tak ada kan, Dr. Nizam?
Not that I know of. What we have here, we have our Jawatan Kuasa Keselamatan dan Kesihatan Pekerjaan lah, the normal JKKP tu at the faculty level, and also kita ada pejabat OSH lah.
Okay, sebab itulah top management ada tanya saya jugalah regarding this, whether the establishment untuk praktis adakah lebih baik di kampus ataupun di hospital. I would agree. Dan macam Dr. Aidalina kata, saya rasa kena bertapak dengan hati-hatilah. We need to consider every parties and stakeholders punya needs.
Ya. Contohnya macam tadi yang doktor tanya pasal klinik warga tu kan. Klinik warga tu ada maybe it can be given to be run by another department yang mungkin lebih they have more expertise lah, yeah, in actually handling medical cases among the staff. Jadi kita pun kita tahu kepakaran tu ada. Jadi mungkin kita boleh serahkan kepada yang pakar lah untuk buat benda tu.
Thank you.
Okay, nampak macam dah tak ada soalan Alright, so I think kita boleh tutuplah sesi kita. Terima kasih kepada Dr. Zaid for your presentation. Terima kasih juga kepada semua yang hadir dan juga kepada our counterparts daripada Universiti Islam Antarabangsa. We welcome you if you want to come, pay us a visit. Kita pun boleh, we can take you around lah to look at what we have so that we can be of benefit, and any opportunities untuk collaboration, research ke benda ke, we more than welcome that, either with the hospital ataupun dengan JKK lah. Oleh kerana ini adalah sesi online, jadi kita pun tak dapatlah nak serve karipap ke apa. So imagine lah ada makanannya masing-masing. Alright. So thank you very much. Mohon maaf atas sebarang shortcomings. Diharapkan this session has been beneficial to everyone in carrying out your work now and in the future. Jadi saya tutup sesi ini. Minta semua kalau dapat isikan borang kehadiran lah yang macam kita dah link dia Puan Khairiah ada up dekat chat box ya. Alright, jika tiada apa-apa lagi saya ucapkan terima kasih dan Assalamualaikum and have a good weekend. Alright, terima kasih.
Terima kasih banyak. Assalamualaikum.
Salam.
Terima kasih.